Today on the Forgiven Nutritionist podcast, I had the pleasure to talk with Dr. Aruna, and you don't want to miss it. She's a board-certified adult geriatric and holistic psychiatrist and the founder of Trinergy Health in Wisconsin. She provides evidence-based root cause holistic solutions that you can achieve health, harmony, and vitality naturally. Today, we talk about how the current medical system could be lacking to really help those with mental health issues. She shares the real root cause for depression, which may surprise you. She's very insightful for how trauma can weaken the foundation for your health in both the body and your mind. You're definitely going to want to stick around to listen. Here's a clip from today's show.
For the first time, I was actually learning real ways to evaluate for root causes, irrespective of the presentation. So it didn't matter that somebody had depression or schizophrenia or ADHD, or for that matter, thyroid disease or fibromyalgia. Because I would see all these conditions, like somebody would come in, a woman would come in with depression, but she would also have a thyroid disease. And I would say, here, take an antidepressant. I know nothing to do. Take your hormones and, go to your endocrinologist. Little did I know that both were coming from the same root causes.
Pendulum has probiotics that will help heal your gut. Their lineup includes Akkermansia, Metabolic Daily, and one called Glucose Control, which is great for anyone wanting to improve their blood sugar levels, and you don't have to be a diabetic to take it. Any of these three probiotics include an important strain of probiotic called Akkermansia, which is only sold by Pendulum and is a key component of strengthening your gut lining and gut health. All of their products are clinically studied and third-party tested for quality. Check out all of their products at pendulumlife.com/discount/forgiven or click the link in the show notes. Use code FORGIVEN for 20% off your first month membership. Why don't you tell my listeners a little bit about yourself, a little bit about how you ended up here in Wisconsin and how you ended up doing what you're doing?
Oh gosh, I will do my best with that. So, I grew up in India. I was interested in science and medicine as a child. And so it was natural for me to go into medical school. But really, when I started doing my rotations in psychiatry, I became very, very enamored by how the brain functions. And that's how, I chose to become a psychiatrist. And I did my postgraduate education in psychiatry in India as well. And then I got married and my husband was working here. So that's how I ended up moving to the United States. And Wisconsin, particularly, we were actually in California, but I fell in love with the people of Wisconsin when I came here to interview for a residency program. And I chose to do my residency here. The Midwestern hospitality and the very down-to-earth. I had really good experiences in that short amount of time when I'd come to tour for my residency interview. And so when I first came here, I had to repeat my residency program. And also I was interested in geriatric psychiatry. So I completed a fellowship in geriatric psychiatry and then started working for a local hospital. I don't know if I can mention the name. You can edit it out if you don't think it's appropriate. I started working for Rogers Memorial Hospital as a attending psychiatrist. And, but the contrast in my education in India and here is, night and day. We were reading the same textbooks, we were studying the same information, but the way it was interpreted was very different in India. Like, for instance, it was drilled into me that because we really didn't know what actually causes mental illness, it was very, very necessary for us to rule out all of the physical diseases that could be contributing to mental illness. So that was a basic understanding that we only diagnose somebody with a mental illness only when we have exhausted all other known causes, which meant that I had to be very familiar with the neurology, with how the brain is functioning, with drug use, and other diseases like nutritional deficiencies that can masquerade, hormonal imbalances that can masquerade as mental illness. But when I came here, the mind and body were completely divorced. Like in India, if I did not complete a physical exam and a neurological exam, my evaluation of a psychiatric patient was considered incomplete. Whereas here, if I this actually happened to me on my very first day. Everybody knew I was a practicing psychiatrist from India. So the attending said, hey, why don't you demonstrate how to do a psychiatric eval for the actual brand new medical student and psychiatry resident. So I interviewed the patient, and after that I stood up to examine the patient, do a physical exam, which as a medical doctor we all should be doing. The attending was aghast. He was like, don't touch the patient. That's medical legal liability. I'm like, well, how are you going to rule out organic or, other diseases that could be masquerading as mental illness? And I was like, oh, we have an internist for that. You don't touch the patient. So I was very shocked, but I didn't want to rock the boat too much. I was like, okay, when in Rome, do as Romans do. And I went down that path, and I saw, even in practice, there would be so many people that would get diagnosed with schizophrenia, schizoaffective, but they're having a primary cocaine addiction. And we all know that these drugs can cause symptoms of psychosis. Again, in India, if somebody had an addiction problem, we understood it was coming secondary to the addiction. So yes, we treated the psychosis or the depression, but we also paid attention to absolutely addressing the main problem, which is the addiction, which then comes from low self-worth and, all of those things.
Right.
Whereas here, the focus was only on the symptom management, not really on the root causes. So I was having a little bit of this dissatisfaction, but really when I became a mom, and I began to learn about toxins in our environment, in our food, and that made me question everything that I was eating, the cosmetics I was using, the home care, body care products that I was using. And then naturally I was like, well, if I'm being so careful for my developing baby and my young ones, and a lot of it, we know that a lot of the brain development happens in that first year of birth. And so I was so careful about what I was, when I was nursing, about what I was eating, what I was drinking, and then what I was feeding them. I naturally thought about the connection between diet and mental health, but there was nothing in literature, in mainstream literature. But I went down this path, started asking questions, and the universe just paved the road for me. So I ended up going to conferences that were in alignment with what I was seeking. The main one was American Board of Integrative Health, American Board of Integrative and Holistic Medicine. And I dove right in. I was fascinated with all the information. And it was, for the first time, I was actually learning real ways to evaluate for root causes, irrespective of the presentation. So it didn't matter that somebody had depression or schizophrenia or ADHD, or for that matter, thyroid disease or fibromyalgia. Because I would see all these conditions, like somebody would come in, a woman would come in with depression, but she would also have a thyroid disease. And I would say, here, take an antidepressant. I know nothing to do. Take your hormones and, go to your endocrinologist. Little did I know that both were coming from the same root causes. And if one person could address those root causes, all diseases can disappear. That's what I began to learn. And so I did get my diploma in integrative and holistic medicine. I became fascinated with, I chose functional medicine and Ayurvedic medicine as the modalities that I wanted to practice. And I pursued further education. By 2016, I was ready to kind of implement this mode of evaluation and treatment in a very full manner. But the powers that be at Rogers didn't like what I was doing. They were like, how can you not prescribe an antidepressant? Well, because they were having severe vitamin D deficiency, or they're having methylation gene polymorphisms, or they're having leaky gut. And I want to treat that first. And if they don't get better, then I will look at maybe medications. Or, hey, look, antidepressants actually do increase suicide risk and homicide risk. Or they can cause akathisia. Oh, look, continued use of antidepressants actually increases more and more depression episodes. Same the case with benzodiazepines for anxiety or antipsychotics for schizophrenia. We are actually making people sicker. This is not what I signed up for. It came time for me to part ways, and I realized in 2016, it was an overnight decision. I realized that if I really wanted to follow my calling and do what my soul was asking me to do, I needed to branch out and start my own practice, which is what I did. And that's how Trinergy Health came into existence. So we opened our doors we had a soft launch in January, but I was still working for Rogers. But by April of that year, I gave in my resignation. I had 3 more months, the notice period to complete, and which I did. And September, I relaunched my practice and haven't looked back since. So that's my story, Wendy.
That's wonderful. And it makes me so happy, not only because you're local, which I love that, but I do think that I want people, not just the clients that I seek as well, but whoever is listening, I want people to get curious and find out what their root cause is for why they're feeling depressed or anxious. And that was something that was never really introduced to me or brought up to me in any of the years that I had suffered with depression or anxiety. I kind of had to figure it out myself over the years. And then in the last several years, when I started doing my own education and learning some of my background, it was very eye-opening and wonderful. And now that I'm on the other side, after changing my diet and nutrition and learning some of the things, the body is a magnificent, wonderful thing that can heal. And if you give it the right things, and the things that it needs, you can do a complete 180. And it's people get stuck in the mentality that it is just a chemical imbalance.
There is
and
no
nobody
chemical
ever
imbalance.
and nobody ever asks. So and even if there is, okay, what's the cause? What's causing that chemical imbalance? When no one ever asks, okay, what is causing said chemical imbalance? And like you said, some of those things definitely for me were hormone related. I know. And because of the things that I was doing, they were causing a lot of those hormone imbalances and other things too. So I'm hoping that some other people really kind of start to shift their way of thinking too, that, I don't have to be stuck with this.
Yeah. I mean, if you look at it, any person that is working in the mental health field for, say, 2 years, 3 years time, and if they're following up with people consistently, they will know. If they're paying attention, they will recognize that, I gave them the medication. They seem to get better, but then I'm not able to stop the medication. For them, they're not able to stop the medication, and they're not really experiencing a full quality of life. That is just the fact. And then not to mention the side effects that come with these medications, from diabetes, metabolic syndrome, microbiome disruption, even, with long-term use of antidepressants, it's now linked to dementia. And I mean, I don't want to be a Debbie Downer, but the thing that is missing is that what you said, our mind-body systems are incredibly self-healing systems. They're capable of self-healing, but maybe our choices can either hinder the self-healing process, or we can enhance the self-healing process. That's really, and so many myths. I mean, I do a webinar every month now online, and one of the topics that I did do was on myths of mental illness. The number one myth is that it's a chemical imbalance, but 70 years of research has not shown any conclusive evidence that there is an identifiable chemical imbalance. So,
right. Yeah. Well, and so I know a lot of people, and I know that you have said this as well, that inflammation is one of the main drivers, and there's a lot of things that can kind of cause inflammation, and I know that you think that there are 3 main root causes, and I'm totally in agreement with what those 3 main root causes are, and I've suffered from 2 of them for sure. So, what are the 3 root causes that you think are really kind of more at the core of why people suffer with depression and anxiety?
And this is an amalgamation. So my hypothesis is my theory is an amalgamation of my education and my experience in observing patients. And if we were to kind of, do it this funnel kind of a process and, look at everything that's going wrong in all their systems and see, pare it down, it comes down to these 3. It's bad diet, trauma, and toxins that we are exposed to. And when I say trauma, I'm talking about physical trauma as well as psychological trauma, especially early life trauma. But it can also be the stress of life, wherein we begin to feel that everything is against us. The universe is against us, and nothing that we do ever matters. And so we lose a sense of self-worth. We forget how to love ourselves. And that is one of the main main causes of any illness for that matter, not just mental illness, but even physical illness as well. And there's scientific evidence to prove this, but there is also, there's a lot of, this has been talked about in the spiritual literature as well, that loss of self-worth and self-love or separation from the source is actually what makes us choose things in our life that don't agree, that are not in alignment with us, which then leads to manifestation of disease process. So, and the way, so whether it is bad diet or trauma or toxins, they have very typical pathways. Number one is causing leaky gut. They affect the gut lining. Bad diet directly affects the gut lining. Trauma creates a hypercortisol state, which also affects the gut lining. And the toxins that we consume through, air, water, and through our food, and even through the skin, also affect the gut lining for the worse. They damage the gut lining. And then that's one of the first pathophysiological processes. Then after that, there is inflammation and immune system dysregulation. And when we actually go back in time in a patient's story, we will always find signs and symptoms of gut issues, sometimes starting with colic in their infancy. That is also an example of a leaky gut. Colic is not normal.
Yeah.
Infants should not, every once in a while, yes, but not, regularly colicky. And so we have to really think, where is this colic coming from? Why is this baby having this gut inflammation at such a young age? So, but when we do the timeline, you can trace it back to as early as infancy.
Yeah. One of the first things that I do with my clients too, which I'm sure you do as well, is we do an extensive health history. And, it's funny because I have some clients that are, my age or even older, and I ask them too, were they breastfed? And they're like, well, what the heck does that have to do with anything? But then you find out that they have had kind of a lot of ear infections growing up after that. And then you find out that they weren't breastfed, and they weren't born vaginally, they were born C-section. So all these little things can play into their health, and it can start to be like a ball that just starts rolling down the hill, and it gets faster and faster and bigger as the ball gets.
And yes, I take all this information because, this is it. And healing is actually educating people, that people need to learn how to take care of their mind, body, spirit systems, and they also need to learn what were the causes. Yes, my intake form asks all these questions, and we're going to explain to them. Well, I'll say something controversial and you can edit it out. So it's, the mode of delivery makes a difference. Whether you were breastfed or not makes a difference. But again, whether you were vaccinated or not and what was your vaccination schedule impacts gut health, because our vaccines have a lot of toxins in them that we are injecting into babies with immature detoxification systems and immune systems. So whether it is ear infections, eczema, and mental health issues or other autoimmunity has been associated with the current vaccination schedule that is. So you can edit it out, but this is my.
I definitely agree. And looking back not only at my own health, but I think back at my children too. I unfortunately followed the protocol where you think that you have to get them vaccinated for certain things at certain ages, and you think that you're being a good parent, and you are doing the best that you can at the time with the knowledge that you have, But then I also noticed, as soon as I've had done things like that for some of my children, the effects that they had immediately afterwards. And
well, I was so unconscious, Wendy, I didn't even realize until I went down this path and I began to connect the dots. I know for a fact that my older daughter, both of them sadly have affected their health state, not for the better. And yes, there was a time when I felt guilty. I have compassion for myself at that time. My older daughter, within 4 weeks of her birth, she developed eczema. And I didn't put two and two together. And then she had that. Plus, she was a little bit emotionally dysregulated. She was biting her nails. So there was a little bit of that anxiety going on. She was high strung, which we thought was her personality. No, that's not. That is brain that is inflamed, that is behaving that way. So it's in going down this path. And, I've seen her, she went from biting her nails down till they were bleeding to completely stopping in 3 months' time. We actually began to see her personality flower when we went through this process as a family. And finally in 2016, I finally, I've stopped vaccinating my kids. And that's when I saw that her eczema completely went away. She had, by then it had become mild, but every winter I would see there was a flare up. Guess what I was doing every winter? I was giving her the flu vaccine. Basically, I stopped taking her for wellness checks, and the younger one too.
Right.
So we really have to pay attention to all the things that we're doing. And they have not been vaccinated since 2016. And they got the flu in 2019 when we had that polar vortex. We all got the flu, but we haven't fallen sick since. And
right.
Even COVID, we are. Yeah, go ahead.
No, that's okay. Yeah, I personally have not been vaccinated for COVID either, and
Likewise.
I know that. Yeah, and I feel great, and I do think though that over the last several years, I've really worked hard for myself and my husband, because my kids are grown, so they're out of the house now. But we've worked really hard on keeping up our health to maintain that good immunity, so that if we do come in contact with a virus, whether it be COVID or just the common cold or any kind of foreign antibody that's in our body that's not supposed to be there, our body can fight it off.
Yes.
It's naturally supposed to do that, and I want it to do that. So that's okay. So
yeah, that's been our journey as well. So I think I was afraid of COVID for 2 weeks in March of 2020. And then I decided to stop listening to the media and do my own research. And I actually read papers about the seroprevalence and the actual infection mortality rate. And I saw that it wasn't as bad as it was made out to be. And yes, people have died, but a lot of it has to do with the state of the immune system when a person falls sick, and also the interventions. But now it's common knowledge that ventilators were the wrong thing to do. Early intervention was discouraged. Oh, wait until you can't breathe, then you come into the hospital. Whereas I started treating with supplements in my practice right when people began to fall sick. And I saw that when we intervened early with the right, lot of vitamin D, vitamin A and C and echinacea and elderberry. I have a formulation that has all of this. And that with glutathione and N-acetylcysteine, none of my patients who took my protocols ended up in the hospital, and they did not end up with long haul either. So
that's wonderful. So if someone comes to you, what's one of their, and I know it's kind of hard to tell, but what's kind of your first standard kind of protocol that you kind of go through? I know that you had mentioned that you give them some supplements. Does everyone get supplements, and do you want everyone to do supplements?
Yes. The supplements we use, so the foundation is diet, because as I said, it's diet, trauma, toxins, and all three are causing leaky gut and inflammation. So we have to repair the gut lining. So for that, we do an elimination diet, and in addition to eliminating certain foods, I prescribe medicinal foods. That's not a supplement. They can, it's a different way of eating for about 3 months that will restore the gut lining. And in doing that, within 2 weeks, patients report 30% improvement in their whole symptoms. So we check the state that people are coming in with a scale called Medical Symptom Questionnaire. And we repeat that every time I see them. So we are able to actually track how each organ system is doing, actually. And we see that at that 2 to 3 week mark, we see a 30% improvement, 30 to 40%. And at the 4 to 5 week mark, we see 50 to 60% improvement. But diet alone can do that. But when we add so we use 2 different kinds of supplements. One is the herbal supplements to reduce inflammation, to enhance digestion. This is all coming from Ayurvedic medicine. It's more than 5,000-year-old system, a medical tradition from India. And the herbs are fantastic. We source from the best companies. It's all organic. There's no contamination. And with these herbs, we're able to restore the functioning of different organ systems. And then I also use functional medicine supplements, mainly fish oil and detoxification supplements and some other things, to restore the microbiome, to enhance the nutritional status. And I also monitor their blood work, and we do some additional functional medicine testing to look for mold toxicity, to look for dysbiosis, mitochondrial dysfunction. So there's so much more that we need to look at when it comes to mental health. And that is what, I hope your audience will get this takeaway that no, there is no chemical imbalance, but there could be a mold infection, or mold toxicity, or bacterial dysbiosis, or heavy metal toxicity, or it could be environmental toxicity. I see a lot of these things coming in. And the proof is in the pudding, right? So we know what's causing the problem, and we intervene to remove that problem, and I see patients reliably getting better. So
yes. What's one of the biggest food triggers that you think that you've noticed that cause a lot of not just leaky gut, but leaky gut, but that also causes that brain issues and problems with depression and anxiety?
It's mostly dairy and gluten, but sometimes eggs as well. I've seen dairy, gluten, and eggs to be the main. Like recently, I had a patient who actually came in with psychosis. We put her on an elimination diet, and her psychosis almost went away. Then we reintroduced the eggs, and her psychosis came back. So we have to be. So the connection between, and people will find it surprising. How really food can cause schizophrenia? Yes, yeah. It all depends on what kind of immune system aggravation we are seeing.
Yes, I can say for myself, gluten was a big one. And every once in a great while, if all of a sudden I think, okay, just today we're going to not worry about what we're eating for this one meal, or we go somewhere and, it's hard you want to partake and enjoy your time with family or friends. And then for days afterwards, I will notice in my own personal personality and the how my thoughts act and things like that. And so I'm a big advocate for gluten getting out of everyone's diet.
So sure. I was diagnosed with Hashimoto's in my early 20s. So gluten was an issue for me as well. And I was actually, don't eat too much gluten, especially outside, which is, not GMO and glyphosate and all that. It's not genetically modified, but there's a lot of glyphosate. I need to correct that. But I just, I've intensified my spiritual meditation practice. And it sounds crazy to say this, but I've seen that I'm better able to tolerate gluten when in certain circumstances that I cannot avoid it. Or if I want to eat something, if I want to indulge, I have seen that it's not affecting me in that same way. And earlier, I think what was happening is that I would be very, very almost fearful. Oh, I'm eating this is not good for me. So I would create that negative energy around the food that I was consuming. And now I've learned to kind of, hey, this is what I have, and I accept it with grace. And that seems to have made, still, I will avoid, glyphosate-rich wheat anytime.
Right.
And I will avoid wheat altogether because I don't want to stress my system, unnecessarily. But every once in a while when that happens, just creating that shift in my thinking, I have noticed that I'm better able to tolerate it physiologically as well.
That's wonderful. Is that one of the modes of healing that you kind of work with your clients too when it comes to trauma as well, I would imagine?
Yes. Yeah. It's really is about being in the present. I allow 1, maybe 2 times for people to really go in depth about their trauma. But the focus is not in rehashing and re-traumatizing my patients. It doesn't serve anyone. Yeah, it's a fact. They were traumatized. It is a fact. No question about that. But what needs to happen is that they were emotionally branded at that point in time and they become stuck in that pattern. We need to teach them how to set themselves free through the process of being aware, being present, and practicing self-love and self-worth. So we start that in the second month. Once we see the body is on track, then we start off with the mind healing program. It really is about getting to know yourself from the inside out. And that's how we go about that.
I know that a lot of people don't really, you touched on it before about how trauma can cause depression with cortisol levels and things, but could you kind of go over that a little bit so people can kind of understand? Because I think that, like you said, when people go through trauma, whether it's a one-time experience or something severely traumatic where it goes on and on, even just that one time, no matter what it is, even if someone verbally assaulted you, it can cause a lot of damage and cause a lot of internal stress that people don't realize. So maybe if you could go over some of that, how it causes some of that stress, which then leads to some depression and anxiety.
Yes, I think trauma is a biggie. And I would say that it's not so much the one-time stress, but it is actually the chronic invalidation that sadly children experience during their developmental years. And it's not to say that parents are bad, but parents are stressed, overworked, and we are all living in this rat race, and we are not able to give that attention that our children need, and that lack of emotional validation. And I'll say I've been guilty of that. I've experienced my own childhood trauma, and I was actually passing it down, to my children until I woke up. And, the thing is that we can put an end to it as parents, and we can raise children by being attentive to them. But what happens is that it's not only the way I like to give a very visually descriptive thing. What trauma does is that it weakens the foundation of our body and weakens the foundation of our mind. So if you look at the gut-brain axis, that's the central pillar that holds everything together. That's the central foundational pillar. And trauma, because of hypercortisol state, puts literally holes in the central foundational pillar, which is holes in the gut lining, which allows for toxins to enter, foreign bodies to enter, inflammation to enter, and then it wreaks havoc in all other organ systems. But when you just focus on the brain or the mind specifically, and the way what trauma does is that it pokes holes even in that, because it's in the mind, our identity, our self-worth, self-love, all of these very nebulous concepts are trying to build on itself, especially in childhood. But the chronic emotional invalidation and the lack of attention and inability for a child to be authentic, for a child to express their mood as well as their voice, leads to a sense that their identity is not worth is not good enough, or their voice is not good enough, their ideas don't matter, their feelings don't matter. And literally, just like I said, imagine the central tube, the body tube is getting filled with holes or poked with holes, and then the top area of this tube is also riddled with holes, which leads to a fragmented sense of self. And it leads to these maladaptive behaviors of pushing and pulling, not being able to tolerate stress, not able to trust oneself when things don't go our way. Sadly, this is what we see.
Yes, I know that that can definitely happen with children, and when you're young and impressionable, and especially if parents aren't equipped for whatever reason, maybe it's just because they're inexperienced, or they're too busy, or something or they're dealing with their own traumas of some kind, and they can't assist their child. I know it can have lasting impressions, and hopefully, if anybody has gone through any trauma, they realize now that they're an adult, they can address it and move forward, because life can be wonderful when you get past some of those things,
Absolutely. And I mean, for parents, I would say, hey, if I can do it, so can you. That's what I tell everyone. I mean, there's no difference between me sitting here in my psychiatrist's chair and my patient who is sitting in the sofa across me. The only difference is that I have had a few extra steps in this journey, and I'm here to show the way to you. That's really, if I can do it, you can too. And I won't say that it is easy, because you have to become familiar with your own thoughts, with your own instincts, with your own choices. And you have to, it's really becoming a new you. That's what it is. And you have to change your thoughts, you have to change your beliefs, you have to change your actions, you have to change your words and your feelings. And before you know it, you have crafted a personality that is in alignment with your soul, that is in alignment with your dreams, your desires, and your wishes. And that's how you create your life and your destiny. So this is what is possible.
Yes, and I know that I've shared with some individuals before who also were kind of suffering through some depression and anxiety, and I knew a lot of their history. Mm-hmm. And I said, when I was going through it, I had to literally force myself, because to me at the time, when you're in the middle of it, and I didn't know all of the chemical things that were going on inside my body as far as the hormonal problems and all that kind of things that wasn't being addressed, but you're never going to feel like doing something. So you sometimes have to force yourself mm-hmm. to get in that habit, and eventually that helps some of your mindset shift mm-hmm. a little bit as well. And of course, if you're working on your diet and addressing some toxins that may be in your home or your environment,
yes,
all of that eventually falls into place even more. But mm-hmm. sometimes you have to force yourself to do things because you're never going to feel like it until some of those things get addressed.
Yes, absolutely. That's why, sometimes working with a qualified professional like you, yourself, and people like me, I think is going to be helpful. And which, that's why I've come up with really 6 months is more than enough for people with depression and anxiety to heal, irrespective mm-hmm. of the length of their illness. It doesn't take long. And so I've come up with the 6-month program. It's a protocol. We provide all the support, we provide all the direction. And in 6 months, we are able to reverse people's health state, both physical and mental. And I'm calling this Psychiatry 2.0. It's a new paradigm for mental well-being.
Oh, I think I've got you, Dr. Aruna. Hello.
This is no exception. So if there's one message that I want to give to your audience, it would be that. And it doesn't have to be only with medications. It is really about taking ownership of every aspect of your life. But it is very much possible to heal from chronic mental illness.
Wonderful, wonderful. And where can my listeners find you or follow you or even book an appointment with you? And I'll be sure to put all this information in the show notes for people, but if you could just tell us where they could find you or follow you.
Thank you. So I am on Instagram. My handle is @Trinergy Health. My phone number is 262-955-6600. That's one of the best ways to get a hold of me and make an appointment. And also through my website. It's psychiatry2.com. It's psychiatry, the word PSYCHIATRY and the number 2.com. And there's people can schedule a free discovery call with me. There's an application form to fill, and they can schedule a discovery call with me. So that's one way to go about it as well.
That's wonderful. Thank you so much again, Dr. Aruna, for being with me today and taking your time, and I really appreciate it.
Thank you so much, Wendy.
I really appreciate you taking the time. You have a wonderful afternoon, and I hope to talk to you again soon.
Likewise. Take care.
Thank you.
Bye-bye.
Bye-bye. Are you looking for a good probiotic? Seed DS1 Daily Synbiotic is both prebiotic and probiotic. It supports digestive health, heart health, skin health, and gut health, including those who suffer with IBS. Their products are clinically studied and third-party tested for quality, and I think you'll be impressed with their eco-friendly packaging. Check them out at seed.com and use my code FORGIVEN for 15% off your first month's supply. If If you want to continue learning and hearing all things nutrition for your mind, body, and spirit, click like, subscribe, or favorite me on whatever podcast platform you use. Or you can find me at forgivennutritionist.com. This podcast was designed to educate, inspire, and empower you to achieve your health and wellness goals with your current healthcare provider. It is not meant to diagnose or treat any illness or medical condition or take the place of any treatments from your current healthcare providers.